First of all, hello, and yeah, I'm Christian. I'm the principal dentist of Wimpole Street Dental Clinic. And for us dentists, the classic signs of dental phobia are you don't go to the dentist. That means we don't actually see you. So, and if we see you, you're always very hesitant to sit down on the chair. You want to sit anywhere else but on the dental chair. You're sweating, you're nervous and crying sometimes. So the signs for us, of course, there's different levels of dental phobia, are always very obvious if somebody's scared of the dentist, which is completely legitimate and most of the time has a history. Well, it's getting less now because dentistry has changed, but especially the little bit older generation, 40 plus, 50 plus, has still had treatments without injections, fillings without injections, traumas when they've been at the dentist when they're younger, teeth pulled out and so on. So dentistry has thankfully changed a lot, but as somebody, I'm grown up in the east of Germany where dentistry was not that advanced, I can relate to that dental phobia question very, very much. And yeah, dental phobia is still very, very common and is completely understandable for us dentists, and we have to deal with it and hopefully deal with it in a kind manner. Like I said, if you're scared of something, you try to avoid it, because it's just completely logical. Going to the dentist can involve pain and can involve discomfort. So the best thing to avoid pain is not going to the dentist. The problem is that most people are very unfortunate and will develop gum problems, decay and so on. So it will catch up with them eventually. And then normally sometimes after 30, 40 years, the people come to us and have a completely destroyed dentition. And then we have to do something about it. So normally the easiest way, go to the dentist when, even for a chat initially, don't sit on the dental chair, just try to get used to it slowly to the dentist again. And then try to build a trust with your dentist. And then maybe start with something small filling or a dental cleaning or something. So just get used to the dentist again. I'm not a psychologist, so I speak as an amateur and a little bit from experience. Dental phobia is not something logical. It's something ingrained, mostly because you had a trauma when you've been a child. So you hate the noise at the dentist, you hate the smell, you hate the pain, and everything brings back memories from a not so good time when you've been younger. So, and the reaction to that is fear, sweat, fear, increased heart rate. So that reaction is completely normal. The most important thing is get this first step out of your door. That's the most important step. Get out of bed, put your shoes on, and if you have the dental appointment, go to the dental appointment. And then if you don't want to be treated that day, that's fine, you may have to pay for it, but it's fine. The first step towards that is important. And it's completely okay to get psychological help if it's something really you can't handle yourself. We treat a lot of dental phobia patients in sedation, and that is completely helpful for them. They know when they wake up, everything is done. They know they're not going to experience pain because we give, of course, injection and so on. So it can be handled much, much better than 20, 30 years ago. Each of us has more than 15, 20 years experience in the field, so we have seen most dentistry has to offer. And of course, many, many dental phobia patients. We have extensive experience in sedation. We work with sedation solutions, and we have fantastic sedationists coming in, absolute professionals, and make the job for us and for the patient and for the nurse much, much easier when the patient sleep and the fear just is alleviated. And of course, we understand where dental phobia, dental fear is coming from. So we will not judge anybody. This is, I think, something patients are really scared of, that they come to the dentist and the dentist is telling them off. Why haven't you been here earlier? Why is so much destroyed? Why didn't you brush your teeth? We're not going to say that. This is completely irrelevant to what we're planning to do. And the goal is always to restore your dental health again. No? So we will not judge. We just focus on the outcome, that you have healthy teeth.